podcast that could change the way you think about cancer and how to treat it. Our top expert is Dr. Sophia Edwards-Bennett, affectionately known to her patients as Dr. EB, a board-certified radiation oncologist who gained her medical and oncology postgraduate education from a Harvard research program from Memorial Sloan Kettering Cancer Center and Cornell Medical College. I'm your host, Mark Grimm. Welcome, Dr. EB. It's great to be with you.
Thank you for such an introduction, Mark. It's great to be here. And
well, let me just say, anytime I see some Harvard, Cornell, and Sloan Kettering in the same sentence, I'm pretty sure I'm speaking with someone who really knows what they're talking about. So it's really wonderful to be with you.
Thank you for that panegyric. I must say that with your wealth of expertise as well, I consider it an honor to be interviewed by you.
Well, let's talk about this, because cancer, who hasn't been affected by cancer? I don't know anyone who hasn't had it in their family or relatives or something like that.
That is absolutely true.
And I know you believe so strongly about your approach to cancer. It'll help improve cancer doctor-patient relationships. It'll bring positive psychological and physical changes in patients' lives and lead to better outcomes for cancer patients. Yes. That's pretty powerful stuff. Tell us more about that.
Yes, indeed. It is powerful. So you mentioned my expertise based on my institutions, the aforementioned institutions where I garnered my knowledge and wealth of expertise. And because I was equipped with that armamentarium of knowledge, I was then able to focus on the passion of oncological care, which is basically just to focus on not just the patient's cancer, but also the mind and soul. So the psychological toxicity that is induced by the diagnosis, the treatment of cancer, and beyond. And
I was just saying, when you hear the word cancer, your heart stops.
Exactly.
When you hear that from a doctor, and so it's not just a medical issue, it's really exactly what you're saying.
Exactly. And the problem is that because of the vulnerability that it induces, and most of us don't want to be in a vulnerable position, but also patients are facing their mortality, and then they feel this loss of control, it actually induces a complex web of a constellation of anxiety, fear, despair. And that is really the construct of psychological toxicity that I feel that I'm called to address. And so when one has passion and then that is met with purpose, that ignites a vision. And then what I want to do is then transform that vision to a path of attaining the mission that I mentioned earlier, which is certainly to address the psychological toxicity so that I can empower my patients to cope with the diagnosis, the treatment, and beyond. Because we tend as doctors to address just the cancer, and the cancer itself does cause toxicity because it's malignant. And then there is the toxicity, the visceral toxicity caused by the treatment itself. But then there is the psychological toxicity, and that goes unaddressed mostly because patients are reticent to proceed with a psychiatric evaluation or seeing a psychologist because there's a stigma attached, and they really don't want to be vulnerable, as I mentioned before, but also because the treatment may preclude seeking or adding another appointment to their, the myriad of appointments that they've now had to just attain just by being diagnosed with cancer. There are some patients undergoing chemotherapy. And then, of course, it's very time consuming, especially with radiation oncology, because my patients are being treated 5 days a week and sometimes up to 9 weeks. And so because I see my patients so often, because they are being treated 5 days a week for up to that many weeks, 6 to 9 weeks, I feel that I'm uniquely positioned to address this issue, knowing that I cannot consider myself at all a psychiatrist. That's not how I'm trained. But I do believe that I've immersed myself in extending beyond just the cancer so that I'm positioned to address just that.
Sure, I want to hear more about this. There's something called the Big C Reattitudes.
Yes, that is
that's really your baby. Tell us more about that, because I'm sure this deals with the psychological toxicity that you talk about. Yeah.
Indeed. And so I developed the Big C Reattitudes to address the psychological toxicity. So the Big C Reattitudes, there are 7, and really the re is the prefix for all. The Big C is cancer, and then the Reattitudes themselves are actually the attitudes that I want to invoke. So there is, for example, the restoration of hope, the reappraisal of life, the reclamation of self-worth, the reignition of purpose, the requited admiration, which I can explain later, as well as the just rehabilitation of the mind, and all of those elements of the Big C Reattitude, I think, implemented in the correct way, has really helped patients to survive and go beyond just surviving, but they develop with all of those elements. They develop this fortitude and this knowing that they've overcome this plague, the psychological plague that accompanies the diagnosis and the treatment, such that they leave with this knowledge now, this armor that they can use to then discover that dormant self that they didn't know that they had, the strength to actually go through this. And then they can disseminate that information to not just their family members, but friends, and prepare them for this journey of cancer treatment if they need to do so in the future. So this can be propagated, and that is the perquisite that is unexpected as well, because we believe that it can only be instituted in the clinic, but it goes beyond that.
I love the term you used, armor. You give them armor to send them out. Tell me some of the reactions you've gotten from some of your patients. What have they told you after you've used this help with this psychology?
So it's quite subtle, actually. So I can tell you, for example, I have patients who are they feel very hopeless because of the diagnosis, and then they're dealing with just life challenges in general, because you can imagine that we all have challenges in life, but then the diagnosis of cancer adds another level that just surpasses and supersedes what we as human beings without cancer have to deal with in our everyday existence. And so what I usually tell my patients when I see them, because I want to immerse myself in that well, and as I stated, I cannot implement the Big C Reattitudes without entering that vulnerable space with them. And it's difficult to do that because patients, like any one of us, we're not really willing to be vulnerable. So the first thing I do is I enter that space by informing them that I am consumed with thoughts about them too. So they're consumed. I consider what they're thinking about when they're diagnosed, from the time of diagnosis, where the day before or a week before they were going on with their daily activities, not knowing that a week later they'd be diagnosed with cancer. And so I think about that process and I discuss that with them. And that opens them up. It opens the door for me to then discuss some of the elements of the Big C Reattitude. The other discussions that we have is that not only is it very just daunting, but also their meeting, what I call meeting with a mandatory meeting with a stranger, which is basically I'm considering myself the stranger, right? And so the day before they are scheduled to see me in consultation, I'm also consumed with thoughts of them, but they're going through the cycle, this perseveration, mulling over what's going to happen at this appointment. What are they going to tell me about what I need to do? What is this going to be like? What will I have to face? And so I discussed that with them as well. So they know that even though I'm not going through it myself, I have placed myself in their shoes such that they know that I am there. I understand what they're going through. And that allows them then, again, to open that channel of communication for me to then employ the big C attitudes. So when they walk in the room, they know that not only were they consumed with thoughts and fear and anxiety, but I was consumed with thoughts about how I can best help them. Not only just to treat the cancer by using the expertise, but going beyond that. Because you see, when I see patients who are referred, who are reticent to proceed with treatment because radiation is a black box, or because they've had some experience with a family member who underwent treatment, who lost their lives, or who experienced really terrible toxicities, or who underwent treatment 30 years ago, and so the technology was not as advanced. I meet those patients, and so my goal is to convince them to undergo treatment so they can actually save their lives, but they're reticent to do so. And so they're not going to be convinced by just my expertise, you see, because they know that when they enter the room, they're already aware of that. So then I have to go beyond that, to engage them in such a manner that I can, over the course, convince them to be treated, and then over the course of their treatment and beyond, help them through this process by employing the big C attitude such that they are then able to stand again with that fortitude that they have been armored with, to go through life in an enlightened way to help others.
How did you get to this point? I'm hearing all this really profound stuff that you're talking about. Give us a little brief description of your career path which got you to this point.
Very interesting question, actually. So you probably know that I was born in Jamaica, right? And I attended undergraduate school there, University of the West Indies, you call it UWI in Jamaica. But I became interested in medicine really because my mother died of lupus when I was 13. She was 36 years old. And I was very just enamored by the doctors and the care team in Jamaica, and how they not only treated my mother, but also how they embraced us, the family, how they embraced me and my brothers, and how they were able to instill hope. So I was very impressed by that. And that was my first exposure, intimate exposure to medicine. And then at UWI, I double majored actually in biochemistry and organic chemistry. And I worked for a year in Jamaica, and I received a call from one of my professors of chemistry. His name is Keith Pascoe. And he said, I have this opportunity for you in the US at Georgia State University to obtain a PhD in chemistry. Are you interested? I selected you. I thought you'd be great. You just have to take the GMAT, and I'm sure you'll do well. And of course, all of that happened, and he was able to he was made aware of this opportunity by Dr. Davin Kennedy, who was a professor there at the time. And so I consider this in one of my chapters in my next book, the blog to book that has been instituted by the Success Network. It's called Disguised and Dispatched, because you see, to be placed on the path of your purpose, you need to have those angels disguised and dispatched to help you, because it was not by chance that I was selected, you see. Mm-hmm. So once I was just immersed in my studies in graduate school, I became interested in the study of anthraquinones as anti-cancer agents. And so I synthesized anthraquinones, and anthraquinones are actually used as anti-cancer agents. So agents such as doxorubicin, anthracyclines, these are adriamycin, these are all anthraquinones that are used to treat cancer. And so because I had to write a PhD thesis, I had to basically be engrossed in reading all of this material, medicinal material as well. And because of that, I then renewed my interest in medicine. And so after the PhD program, I entered medicine at Cornell. I was, what it takes, MCAT, etc. And when I entered Cornell, I knew I was a non-traditional student, as they say, because I had already obtained my PhD, so they call that a FUDMUD. But because I knew that I was interested in oncology, in my first year, I actually shadowed Dr. Carol Portlock across the street, because, as you know, Cornell is in Manhattan and Sloan Kettering is across the street from Manhattan, and so it's close proximity. So I shadowed Dr. Carol Portlock for the entire first year. And then at the end of first year, I expressed my interest in clinical research, and she introduced me to Aki Yahalam, who was a radiation oncologist. And that is how I became interested in radiation oncology, again, disguised and dispatched.
Wow. There must have been a time, because you said the healthcare that your mother got, you thought was pretty good, even though you lost her when you were 13 years old. Yeah. There must have been a time when you saw some medicine that said, you know what, we can do better than this. We're not really getting at the psychological toxicity, to use your term. What gave you the push in that direction?
So what gave me that push? What enlightened me? As I said, when passion meets purpose. So my passion was to go beyond. And the expertise that I gained from the aforementioned institutions allowed me that leverage, that level of confidence to focus on that passion, right? Because I always wanted to, I realized that web, that complex web that was being woven, that psychological toxicity, anxiety, fear. I realized that when I was treating patients all over the country, internationally, I treated patients in Jamaica, I was presenting in Barbados, and I was being asked questions in Antigua, I realized that was not being addressed. The questions being posed, that I gained insight from that was not being addressed. Those questions were very common, and that is what led me, you see, because when you're passionate, you want to delve in to what you could at 2 a.m. in the morning, you're woken up by these thoughts of how can I best do this? And eventually that eureka moment arises, and that is when everything, it's just everything coalesces, everything is collated. And after much refinement, then I developed and introduced what I coined the Big C Attitudes.
Mm-hmm. Now you're an author. You co-authored a book with Jack Canfield called Success. Yeah. And tell us more about that.
So in the book, I actually define success as the fulfillment of purpose, because I strongly believe that you don't gain fulfillment unless you are actually enacting your purpose on this earth. And I do believe that we all have a purpose. And I may use this biblical term. When you're not fulfilling your purpose and when you find your passion, it's like as Jeremiah said, a fire shut up within your bones. And I didn't say that in the book, but for those who are so inclined, that is how I felt at the time. And so I describe that passion in my book, and I also describe the Big C Attitudes. I won't give away much secret because the book is actually going to be out soon. It's going to be released soon. And so
early 2021, I guess is the schedule.
Actually early 2021, but we may be surprised by an earlier release, but that's as much as I'll say.
Something we got to look out for.
Yes. And I had the opportunity actually to be interviewed by Jack Canfield in Hollywood. So, and that was, it was also just an honor. It was incredible. So that will also be released soon.
Now, let's talk a little bit about your network channel, REVOXYLIFE.
Yep.
It seems like and by the way, where do you get time for all these things that you're involved in?
I think I alluded to that.
You certainly got the passion for it. Nobody's going to say, well, that's a passionate woman right there.
At 2 a.m. in the morning. So, what's interesting to me, this reminds me of an expression, some expression that my PI in grad school, Dabney Dixon, she commented once about the pKa's of amino acids, and she said, with a temperature of 105 at 2 a.m. in the morning, you should be able to recite all the pKa's of an amino acid, and that's what I call passion, right? And so it really does consume me, and that's the truth, and that's why I believe it's my purpose on this earth. Our purpose is not really for us, right? It fulfills us, but it's really for others. We're really placed on this earth.
Yeah, tell us more about the network channel, though.
So the network channel. So I named it REVOXYLIFE because there are, I believe, in the revelations from the oxymorons of life. So the Rev is revelations, and then oxymorons of life. And that is that, an oxymoron is basically the opposite, right? So from pain, there's gain in pain, right? There's gain in loss. There is strength that you gain from adversities, right? And that's basically the main goal. And so I've been through many adversities, with my mom dying young and then my brothers having to take care of me, and they were teenagers themselves, and several obstacles along the way that I will not really delve into at this point, but in future podcasts you learn more about me for sure. My listeners will learn a lot more about me, but I think that connects me with my patients, because the revelations that I gained from my adversities, I believe that there are revelations to be gained from going through this process, this treatment course for cancer as well. And the Big C Reattitudes actually leads to that, you see. So I think that's that connection for me. And so that's why I named it as such. And on my channel, you can find inspirational proses. My last was Intentionally You. There's a purpose, there's an over the limit, and that's all about just encouraging not just cancer patients, but all my listeners or readers just to delve into who they are authentically, because you see, you have to be intentionally you. Because what I found about being intentionally you is that what it does is the world gains from being intentionally you. And if you are not irrevocably, irrefutably, unapologetically, intentionally you, then we all lose if you don't choose to be intentionally you.
I want to talk a little bit more about the psychological toxicity. Yeah. Can you give me an example of what it looks like and how you treat it with your patients? In other words, identify when you see it, oh, this is toxicity.
Right. So I alluded to earlier when patients are just reticent to proceed because of fear, right? And so I went through the process of how I addressed that. I have patients who have lost their self-worth and self-esteem. For example, a patient who underwent hormonal therapy for breast cancer or underwent mastectomy, and they're seeing me for post-mastectomy radiation therapy. So they've lost their self-worth and their self-esteem. And that also leads into or bleeds into then loss of just purpose. And so what I do is I use the Big C Reattitudes to then reclaim all of those by encouraging my patients, allowing them to see what's inside of them that is not lost by the external aspect of what we can see, but it's what you cannot see. So I reignite all of that, and there's a whole a series of visits that have to occur for me to infuse that in my patients.
Mm-hmm. What is the best thing a patient ever said to you?
Wow. I've been blessed. The best thing. That's a difficult question. I've had so many patients.
It's hard to pick one, isn't it? Yeah.
They've said they're just so grateful to have me as their doctor. They've told me I go above and beyond. I had a patient actually whom I treated in South Dakota, and she had stage 4 breast cancer, and she lost the battle, and I was in a different state practicing, and her husband called me the day after she died, and he told me, he said that she basically made him promise to call me because she knew she was going to die. She made him promise to call me just to reiterate the impact that I had on her life, and that it was just such a blessing to have me as her physician. And that was so powerful. She died on August 30th, and I received the call that Monday morning, and it was.
So in the final moments of her life, she told her husband, make sure you call Dr. EB on how much she meant to me.
I didn't know how much I appreciate. Wow. She appreciated me. When it comes from the heart, it goes straight to the heart.
I wonder, Dr. EB, you're so vested in your patients, and so many of them die. How do you manage that? How do you manage that grief?
It's difficult. It really is. It's difficult. I understand that I will lose some patients, and some. I guess it's never offset by the patients that you save, but I think knowing that I've given it my all, I think that's why I need to, because it helps to know that to the last minute I gave it my all, and I was able to somehow touch them in a way that they could also learn more about themselves and leave a legacy for their family members, right? Because they're in a different frame of mind, you see. Even when they're about to pass, they're in a different frame of mind because of the reattitudes. And so they can pass that on without negativity, right, to their family members. And I think that's what gives me peace.
You strike me as such a spiritual person, and I don't mean that in any formalized religion or anything. How do you use that to touch the spirit in others? Because they all have a spirit, and I can't imagine how hidden it may be at a time when they've been told they have cancer. How do you reach their spirit?
Right. I talked about just making sure that they know I'm vulnerable, but when I walk in a room, I do believe that because this is my purpose on earth, I think I walk in the room with the spirit of a higher power. And I think when you have that spirit, I think it emanates. I think it can be felt in the room. And I allow that spirit to guide me. And sometimes it gives me intuition and insight that I probably wouldn't have gained otherwise, because I believe that, again, I'm placed here for a reason. And that is why I have that burning desire to do what I do. And at times when patients do open up, or they acknowledge that they are spiritually inclined, we have that discussion. So, because I do not want to impose my beliefs on others. There are patients who may not be so inclined, but when they are, then we bond at a different level as well. And so it's very helpful. Yes.
Talk about your belief system and how that affects your whole mission.
Yeah. So that question actually came after I probably stated that. So my belief system is that we're all here for a purpose, and that's the purpose we need to fulfill. And that is my mission on earth. I think that we are equipped with all the gifts that we need to fulfill that purpose. And as long as we can somehow dig deep with deep introspection, we may be able to find our purpose. And again, when that is coupled with passion and the gifts that you've been blessed with, that's all you need in your armamentarium to go out in the world and make a difference. And again, you have to do so by being intentionally you. And that, in doing so, you can go over the limit, because that's what we're greater than we think we are. We have more in us than we think we do. And that's what this has taught me. We do. And my patients teach me that as well. You see, that's what the requited admiration is all about. Because they're my patients, they're heroes. As far as I'm concerned, they are. Because they're going through a process that some of us, we are all daunted by the word, as you stated, by the term cancer. I mean, it's daunting, right? It's intimidating. It is, again, facing your mortality. But they do that every day. They wake up with that knowledge, right? And
Yeah.
I'm sure there are mornings that they think that it must have been a nightmare, and they're, because sometimes we do have nightmares, and then we wake up and we're happy that it wasn't actually a nightmare. But that's not the case for them. They wake up and they realize this is actually reality, but they get through it every day. They dress and they come for treatment, like I said, for my patients every day, 5 days a week, for up to 9 weeks. And they do that. So that's requited admiration. So they tell me how much they admire me, my knowledge, my expertise, and how I'm able to treat their soul, their spirit, their mind. And in return, I tell them that they actually inspire me to do just what I do. So it's reciprocated, you see.
Mm-hmm. How does the medical profession need to change so that we see more of the big C reattitudes? How would you change it if you were?
How would I change it?
You were the czar of medicine.
Well, first, it would be disseminated so that it can be instituted in all of the clinics. And as my husband says, not only for cancer patients, and you alluded to the fact that it can be applied beyond that. But I think we need to physicians need to have more freedom to employ such methods. And to do so, it cannot be, I have to be PC about this, but it cannot be tarnished with, financial gain. As I tell my patients, I tell them, listen, I can spend as much time as I need to spend with you. And as you know, that is an issue in medicine where you're not allowed to spend as much time as you need to spend with patients. You don't know what patients are dealing with. And sometimes in OTVs, my on-treatment visits, that's scheduled for 5 minutes. But the patient may have had a rough night, and they need me to help them process that. And so I cannot just leave them because there is a time issue and there is a financial aspect attached to that. And so I think we need the freedom to be the doctors that we train to be. I think we need that freedom to do that. And so monitoring our time, it's not really going to advance that for sure. And also insurance. I tell my patients, I do not make my decisions based on the insurance that they have or the lack of it thereof. So I never know the insurance that my patient has. I never know what insurance they're associated with. I walk in the room without that knowledge because my recommendation cannot be based on that. And so I think all of these things need to be considered if we are indeed supposed to treat our patients, not just to the best of our ability, but beyond that.
Yeah, I just think there's so much bureaucracy and red tape. So much of medical dollars is spent on red tape, you doing paperwork rather than being with your patients.
Yes. Yes. And that is why it takes up to 2 or 3 a.m. in the morning, because you see, I have to do all that paperwork, but I want to spend time with my patients as well. And then I want to process so that the next day I want to hit the mark. So I want to be able to, if there's a problem my patient's having, that I somehow have not addressed adequately, I need time to think about that. And during the day with all the paperwork, I can't do that. So that is where the 2 a.m. and 3 a.m., that's where that comes in, where I can have, I'm in my thoughts and I can mull deeply over, all these issues and psychological toxicity, and then I'm able to address it, effectively in clinic.
I'm curious, Dr. E.B., how other doctors react to you. Because you're clearly different, and in a nice way, but they may be more established based on the establishment thinking, if you will. And I'm curious how they react to you.
Be a little bit more explicit about that question.
In other words, the way you approach things is maybe different than the way they would, and I'm wondering how that meshes.
Yes. So, of course, every physician is different, and so there may be, as you said, there's bureaucracy at play, and there or different approaches may cause some. Because it's on another side of the spectrum, it may cause some rattling of sorts, but at the same time, I think we're all good at our core, and because of that, I think that they recognize that it's what's best for the patients, regardless. But you are correct. I mean, we're all different, and so our practice is going to be different. And so, yes, there may be some opposition. Mm-hmm. I have faced opposition in the past, I should say that.
Yeah, I wouldn't want to be on the other side of that. Opposing you, sure.
Well,
all the passion is coming out.
I'm convinced, again, there's that unction inside you. I'm sure you felt that before. It's not that I'm not malleable, but when it comes to my patients, I don't believe there's any other way. I really don't.
Mm-hmm. What closing thoughts do you have, Dr. E.B.? We've covered so much ground, and so much of it profound. I wonder what closing thoughts might you have?
So you asked me about my book, and so I'm going to cheat, and I want to close by, I have several prose in my chapter, but I want to close with the requited admiration. And I started off by stating, this is the epilogue, last but not least, our patients effusively express their appreciation to us, which I usually graciously accept. But forthwith, I pose this question, an idiomatic citation. Do you see what I see? The answer underscores our requited admiration for our cancer patients. While we treat them, they enlighten us. While we encourage them, they inspire us. While we advise them, they edify us. While we heal their bodies, they enrich our souls, because their journey embodies the resilience of humanity, epitomizes the essence of hope, and encapsulates the true meaning of life. So let's all collectively aspire to higher ground. And that's the title of my book chapter, Higher Ground.
That's a beautiful way to end it. We've had the great privilege of speaking with Dr. Sophia Edwards-Bennett, just a top expert in cancer, and really, I hope has changed the way you think about treating cancer. This has been, this podcast is REVOXYLIFE, a pandemic of inspiration. I've been your host, Mark Grimm. Dr. E.B., it's been wonderful spending this time with you.